Hey everyone, and welcome back to yet another exciting video on Bridge Builders Academy, where we bring you stories of professionals who have taken unconventional career pathways and are making a remarkable impact. It is very interesting to see how clinicians in today's time are showing interest towards health informatics or digital health, and they are open to adapting technology in healthcare to improve patient care outcomes and the overall health status of the population. If you remember, our last video was with Dr. Anup on medical engineering at IIT Bombay. Today, again, the guest that we have on the channel is pursuing her PhD in health informatics at IIT Roorkee. And it's amazing to see how the IITs are also open to support clinicians to learn on how technology can be integrated into healthcare. So let me introduce our guest today. This is Dr. Mansi Bansal. She completed her BDS in September 2022 and qualified NEET MDS and INI CET with good rank, which is a basic requirement for admission in PhD program at IIT in the Department of Biosciences and Bioengineering. Her focus and desire to get into a top notch institution for health informatics in India is an example of how dentists can utilize their learning and carve a career for themselves with a brighter scope and future in India. So let's dive into her fascinating journey and understand how you can get ready to pursue PhD in health informatics at IIT right after your BDS. Hi, Dr. Mansi. A pleasure to have you on our channel today and talk about how to pursue PhD in health informatics after completing your BDS. So, welcome you on the channel.
Good afternoon, ma'am. Thank you so much. It's my pleasure to be there on your channel, and it was my dream to be here. And thank you so much for having me here.
That's great. That's amazing. So, before I get into the details of how one can get into PhD program right after their BDS, I would like to know what motivated you to pursue health informatics and not any other field, maybe in dentistry, after your graduation.
Ma'am, during my third year of BDS, I was totally interested into research, but I always had this in my mind that we can do research, that is PhD, only after post graduation. So I didn't focus on it much during my internship and started preparing usually, like as everyone does, for MDS. And so I knew just that we have two options, that is either do MDS or go to Canada and go MHA or some course. So, but still, there was something in my mind that I have to do it. And when I was just scrolling my YouTube, and thereafter, it was that I came across a video which showed that we can pursue like PhD after bachelor's, and also health informatics was something that I've always been interested in because it would involve health as well as it would be related something to a digital world, like how digitally we can be involved in improving the health of people. And the second major motivating factor for me was my brother. He got selected in BITS Goa last year in electronics and instrumentation. So I had this feeling that I also wanted to want to be there in some very good institution, and that to something related to computers. So this was my motivation.
That's great. That's amazing. Glad to know that you explored your field of interest during your graduation time only and developed more interest towards it. So that's amazing. So, as a dental graduate, how should one prepare for a PhD program and that too in IIT?
Yes, ma'am. First, the basic criteria for selection here is that we should have given the basic major competitive exams, that is NEET, MDS, and INICT. So, INICT, as we all know, is an examination for AIMS. So, in these two examinations, we should have a somewhat of decent rank. After that, if we have that, we could apply here. During applying, we have to give our SOP. SOP is statement of purpose. So a statement of purpose should be really strong. If that is strong, that would attract the panel and they're going to shortlist us. So when they'll shortlist us, after that, the entire procedure goes that we'll discuss further. So basic thing that one can prepare is prepare seriously during your grad days for these competitive exams. And also you should have in mind that what should be your statement of purpose. Like what is your interest in research and what is the purpose you are coming here. So these things should be clear in mind. And this is what one can prepare. But preparing seriously for the competitive exams is the major thing
Okay.
that would help.
Yeah. So when you mention about these two examinations, a graduate will have to appear for both of them or either one of them.
Uh, Either one would also work, but if you appear for both, it would add on to your shortlisting.
Okay. I think that's fair enough. And the preparation for both would be the same like how we prepare for, MDS, right? NEET MDS.
A bit different it is, but that we can cope up, I guess.
Okay. Yeah, that's great. So what is the application process like? So once you have done the examination and then you apply for, PhD program in IIT, how does this process go like?
So, PhD admissions are conducted twice in a year. One is autumn semester, one is spring semester. So, I've been enrolled in the autumn semester. The spring semester admissions will be conducted in few months, maybe 1 to 2 months away. So, in the entire process, first I told that we have to prepare for the examinations, and also just preparing for the examinations is not enough. We should have a decent rank. After that, we have to give a statement of purpose that we would be filling and providing them through the online. Then we would be filling our application form. Along with that, we give our statement of purpose. If the statement of purpose is strong enough, we would be shortlisted. And after 15 to 20 days of that, we would be called to IIT Roorkee for the interview. So, a panel of 10 to 12 people would sit and would question you on various perspectives, on various aspects. So, we as BDS professionals, because we are actually coming to a different stream, so we need to be very well prepared because they'll ask you on certain things and would also test our mindset that are we really prepared for it? We are not going to leave it. And also certain medical questions they are going to ask. So that is why I'm emphasizing that preparing for NEET MDS seriously is mandatory. And then once we give a pair for an interview, so my interview went for around 45 minutes to 1 hour. And in other cases, it was like 10 minutes. But my interview was little longer because of my being from a different stream. And then after 15 to 20 days, the result was displayed. And after 1 month later to it, we were admitted here. So 14th of July was our first day here.
Okay, that's great. That's amazing. I would like to understand like, what they would be asking specifically from a medical or a dental background.
The questions, ma'am, they would be asking, yes. So the questions they would be asking is first the basic questions they'll ask, not related to theory or something, like why are you here from a dental background, and since you are here, so what all changes would you like to make, what all research would you like to do. So since my statement of purpose also included 3 to 4 of my research proposals, so they were impressed by it and they were satisfied by that. Then they'll ask us the basic questions related to medical, like the various bones. They'll ask the bone in the shoulder, what is it being used for, the muscle which is being used for giving injection in adults. They'll ask the questions related to biochemistry, the various molecules, the various amino acids. They'll ask. Then they'll also ask about the dental. They'll give us situations like if we are performing RCT and it doesn't go well. So, like manual RCTs don't have that much success rate. So, what can you develop for that? The alternative for that. These type of questions they'll ask. Then the ear ossicles or the questions related to it also they'll ask. So I also made a presentation on my research proposal. So I thought that they would not like to see it, but fortunately they gave me time for it and they also saw my presentation. So all these things would add on. So you could also do something like people could also do something innovative of their own, so that you have an upper edge.
Yeah, that's right. And also, any kind of publication research area required when you are doing PhD. Like for example, when you're sitting, Anand might ask that, have you done any paper, or have you presented any paper conference, or in journals? So do they ask these kind of questions also? Is that also a prerequisite?
Uh, yeah, ma'am. For like us, because I was from BDS, so they didn't ask me this, but definitely about the conferences they asked. So during my BDS days, I attended around 25 conferences, like various conferences wherever they were conducted. I used to attend, so I had the certificates of them. So that helped me out at that time. But otherwise, about publication or paper, they didn't ask me.
Okay, I think that's fair enough. So, any key point or highlights that you would like to, mention for any graduates, the audience who are planning to do this?
Yeah. For all those who are planning to come here, please don't hinder yourself thinking that we are not from this background. It would be difficult for us, or we don't know coding, we don't know language, we don't know bioinformatics or something. If you have the courage to think about it, you also have the courage to be a part of it. We would learn it. So I would just motivate all of the graduates to not just constrict yourself to the basic two options of MDS and going abroad. These options are also good in India, and also since we are doing it from these prestigious institutions, research, we are doing it from here. So it adds on to our career, and also it would give us more of the job opportunities, and also it would help us in entrepreneurship. So the key point here is that keep exploring. I explored this, so all the audience can explore something else. Just focus on what you are interested in, so that you are able to perform well. So passion and profession, if they come together, I think they can do wonders.
Correct. And also, curious, like now, since you said that, if someone has, they are really motivated, they will be able to make this transition. So from a BTS
Yes.
without any formal education, say in the field of health informatics. Usually, how like for example, how I did BDS and then I did a postgrad in health informatics, and now I'm pursuing a PhD program. So I have that basic knowledge of health informatics during my masters. So how do you cope up
Yes.
this transition? How easy it is to transit from a completely clinical knowledge to a mix of clinical and technology. Is this taught during your PhD work?
Yes, ma'am. We have subjects like algorithm, bioinformatics, structural biology, computational bio as our subjects in our coursework. We are also being taught mathematics, which would be needed for algorithm and everything. So we are taught basic of it. Coursework does not include all of it. So we have to do things on our own as well. So making a transition sounds interesting, but it's not easy. Like you'll have to put in lots of hours. Like even at late nights I'm working, although it's not mandatory, but since I don't have a background in it, so I need to work hard for it to achieve it. So when you change your stream, it's good that you're able to achieve your goal, but the basic thing is that it's very important to sustain here. Like if you have achieved something, we can't just think that okay, now I'm an IIT and something. No, you have to sustain here, because already you're making a transition, and so ultimately you will have to perform well here.
Yes.
So it would demand lots of hard work. We should have come with this mindset that I'll have to work really hard. Life is not easy here as well.
Yes, correct. So as you on Saturday, we are shooting it on Saturday. So on Sunday also she's in the campus, and she's trying to make this transition work for herself and working really hard towards it. So all you audience, I hope you got answers to the questions how you can apply for PhD, what is the application process, how do you get shortlisted, the kind of questions that they might ask you during the interview. So if you have further, always go back to Dr. Mansi, and I will share her LinkedIn profile in the description. You can connect to her and ask her more. So going further ahead in the session, I would like to ask, usually after PhD, research area. And of course, it is academics and research which you explore after PhD. Apart from that, there is a lot of myth that after PhD you can't get into corporate sector. Is that true?
No, ma'am, that's not at all true. various of my seniors, they have applied for in various MNCs, and they'll be doing job there in few months. One of my seniors, she went to Pune. I don't remember exactly the company name, but into corporate section. So it's not at all, and also there are campus placements for PhDs as well. So MNCs do recruit PhD students because we have an upper edge of having more of knowledge. So it's totally a myth. And also we can because we are from health informatics, we can also apply in various pharmaceutical companies, so we'll get the recruitment there as well. After PhD, I think in health informatics it would open our areas broader, career wise. Like one, we can be an assistant professor once we get out of IIT. So we can be assistant professor at AIMS as well, because we are from the medical stream at NITs, triple ITs or IITs. Then of course we'll be scientists, so we can work as scientists in India or abroad, and we can pursue our postdoc from abroad and come back to India, which would again help in getting jobs. And also corporates and industrial sectors are open for us. So it's totally a myth that we can't go there. We are very well eligible and we are recruited there.
Yes, absolutely. The audience who think that, after the academics and research, that's not get apply for corporate sector as well. So, Mansi, just, curious to know how many number of students are there in our batch right now?
This session, more of us were recruited, more of us were being taken into the batch. So total, we are 29 students here in science and bioengineering department.
Okay, and how
And
many?
in structural and computational biology, we are around 5 students, and out of that, 2 of them are there in my lab, like me and one of my lab partners. We are doing our project on medical and health informatics. Others are involved in some other projects.
Okay, great. And how many are actually coming from a medical or a data background? How many clinicians in the
Um,
batch?
it's for the first time it's happening. So my professors also told me this, and also my seniors, that it's for this first time this transition happened.
Oh, that's great. That's amazing. So first in your, in the batch. Okay. So, I think you've answered most of the questions, opportunities I had, the question in terms in, how can one find, but then as you mentioned, there are campus PhD as well. So I think, any other thoughts that you have for the audience?
Just stay positive and have patience. After BDS, I've seen most of the people and most of my batchmates, they are just juggling with the thought of what to do and what not to. Just don't be in a rush to do anything and everything. Just think about it. And internship, I think, is the best period where we can explore and we can give ourselves time. So don't take internship as an enjoyment period. Do enjoy. Enjoyment should be a part of it, but not the entire internship should be spent in that. So internship is where our goals and career is being defined. So if we waste our internship, after that we'll have a regret that we wasted 1 year and we didn't thought of anything else, and we'll think that other of our batchmates are moving ahead and we are still there sitting at home doing nothing. So just be little concentrated and focused on your career. And even after the internship, if you feel that you have something else to do, go for it. But we all should have a plan. Like, are we really ready for it? We should not be a part of the herd that what everyone else is doing, we'll also do that. Just have the courage to pursue your passion. This would be my message.
That's amazing. That's great. See for coming on our channel and sharing journey. It's really inspiring and seeing, it's amazing because I did health informatics 10 years back, and there was a lot of reluctance from your peers itself that, why are you making this transition and why are you, not sticking to dentistry. So now when I see students like you coming out of that traditional path and pursuing your area of interest, it is really very motivating also and very inspiring, I'm sure, for the audience as well. So thank you so much for sharing your journey. It's amazing to have you on our channel today.
Thank you so much, ma'am. It's in fact people like you who motivated us to think something out of the box. And your channel inspired me a lot that it's not just two or three options we have after BDS, but a lot more we have. So thank you so much. In fact, your channel is the one which was a major motivating factor for me. And because of this only, I was able to convince my parents as well that I think I should go for something else. And thank you for having me. Great pleasure.
Thank you so much. Thank you for all the and all you audience. I hope you also getting motivated and inspired by her journey. If you have further any questions on how you can go ahead with PhD in health informatics, you can always go back to Dr. Mansi through her LinkedIn and ask questions. So that's it. I will see you in the next video. And before that, don't forget to like, share, and subscribe this video in your network, as this might help you guys to understand that you can apply PhD program in health informatics right after your BDS. Also, we have started with 7th batch enrollments for Health Informatics Foundational course. If you guys are interested and want to know about the field, what are the basic concepts that are covered in health informatics when you pursue your master's or a PhD program, and you want to understand better about the field, do let us know. You can reach out us on the number that is flashed on the screen, and I'll be happy to help. So I will see you in the next video. Until then, bye and good luck.